And speaking of sleep, there's certainly a point in your routine where you actually want to sleep longer than 60 minutes. And that's, of course, at night. According to the Sleep Foundation, the pandemic has created a host of new challenges when it comes to sleep, even for people who previously had no sleeping problems at all. Joining us to discuss is Dr. Anita Gupta, anesthesiologist and faculty at Johns Hopkins School of Medicine. Dr. Gupta, thank you so much for joining us.
Thank you.
What are you hearing about sleep when it comes to the coronavirus pandemic?
Well, look, as you know, the COVID-19 pandemic has impacted so many people, from social distancing, closures and quarantines, and even working from home. So routines have been impacted, including sleep. And sleep is restorative, and it is critically important that people have a routine that even with the pandemic going on, and particularly when we talk about napping, individuals that continue to nap throughout the day, even if it's short naps, can impact their nighttime sleep quality. So evidence has indicated that we need to continue to have, that sleep inertia and have a good long sleep throughout the night and minimize those napping throughout the day.
I certainly envy some friends who run on like 4 or 5 hours of sleep and seem to be just fine. I think I need like 9 to 10 to function. So how does a lack of sleep really impact your mind and your body?
Look, studies have shown that excessive sleepiness can hurt performance. It can wreak havoc on your mood. It can, in fact, lead to depression. And so sleep deprivation can leave you exhausted. So we need to remember that sleep is incredibly important to adequate concentration. It can help have your body functioning the way you need it to. So, we have to have that sleep at all times, maximum, 8 to 10 hours, so that we can function appropriately. Now, many people have different types of disorders, and there's all kinds of types of sleep disorders that are out there.
I hear often, just anecdotally from friends, and also especially in the news industry from colleagues, that people have trouble sleeping. So what are the most common sleep disorders?
Right. There are many. And so some of the most common, as we know, is insomnia. There are approximately 80 different types of sleep disorders. About 70 million Americans have sleep disorders, but insomnia is the most common and, one of the most serious. But there are others that are linked to obesity. For example, sleep apnea, narcolepsy, and restless leg syndrome. These are some of the most common types of sleep disorders that exist. And if you have them, you need to talk to your doctor about it, because there are treatments that exist for them.
You just mentioned insomnia. More than 3 million people diagnosed with it each year. So what are some of the symptoms and the causes of that one?
Look, insomnia, difficulty falling asleep at night, waking up during the night, waking up too early, and not feeling really rested. So if you're tired, you're feeling irritable, and even sometimes depression or anxiety, not having appropriate attention throughout the day, and sometimes having that ongoing worry during this pandemic, those are some of the symptoms that you can see. And certainly if you have the kind of stress you're having right now, having traveling or work-related schedules, those could certainly impact your sleep schedule. And obviously, computers. We're doing a lot of Zooming right now, and that could certainly impact your sleep as well.
So let's talk about some of those factors, because we know people are working from home on their computers, or maybe just trying to stay in the know of what's going on, so checking updates on their phones. How do factors like screen time or even your caffeine intake impact your quality of sleep?
Right. So look, caffeine is a stimulant, and the most obvious is that, you want to minimize it as much as possible. The morning caffeine people will continue to do, and that obviously is okay. But when we have that late coffee or caffeine, it can also be an impact on your nighttime sleep. So it's important to reduce that, and limit that to before 6 hours before your sleep, and certainly minimize that as much as possible. Electronic devices, interestingly interestingly enough, emit a light that can certainly impact your hormone melatonin, which helps you sleep. And that can actually impact your natural internal clock and your sleep-wake cycle. So it's important to reduce your computer and screen time to a healthy amount. I know it's difficult while we're working at home, but certainly as much as possible so that we can have an effective duration of sleep throughout the night.
And Dr. Gupta, we just have a couple seconds left with you. If you are still having trouble sleeping, any notes or advice for viewers?
Check with your doctor. There's a lot of conditions, including insomnia, that if you're not doing all the right things, doing all the things, including diet and lifestyle that are not working, you certainly can get and seek further treatment that could help.
All right. Thank you so much, Dr. Anita Gupta, anesthesiologist and faculty at Johns Hopkins School of Medicine. Really appreciate it.